Hi guys, welcome to the Your Vision, Your Turn introductory module, which you'll be watching before our live broadcast. And this is where you're going to go ahead and set some goals for your practice. You're going to put them down on a paper, you're going to think about them, and you're really going to start to formulate a plan that's going to help you when we start to go through our live broadcast on how to reach those goals. So let me first say congratulations. You've taken a big step by registering for this webcast. And if you're like so many other doctors in our country who are trying to balance the demands of caring for patients while juggling to find their way through an ever-changing hostile world of healthcare, this is again that first step towards that. And I have to applaud you because you are in the minority. And what you really are saying is that I know that medicine needs to change, and I'm going to go ahead and be an advocate for that change, and I'm going to start to change my mind from being a victim mentality to be somebody who's going to go ahead and actually take charge of their life and take charge of their patients. So does this sound like you, or are you working over 60 plus hours a week, probably earning less today than you were maybe even 5 or 10 years ago for that matter? We've got more government, more insurance regulation than we've ever had. And if you look and you read and everything you come across, you're going to find that it doesn't look like it's going to change anytime soon. And if anything, it looks like it'll actually get worse over time. So it is time to come up with a plan on what you are going to do for you and your practice and your patients. Are you struggling to make payroll? Are you worried about that? Have you ever had to take out temporary loans to cover your expenses? Are you finding that you're spending less and less time with your family than you've ever spent? And it's really hard striking that balance and finding a good balance where you're able to provide for them, provide good care for your patients, while spending the amount of time that you know you want in your heart to really be with your family and be with your children and to do the things that you love. Or maybe you're just somebody whose practice is really doing well already, but you still kind of know that there's more out there, that you're just not reaching your potential just yet. And this webinar is really for all types of practices, but these are probably the two main ones that you may find yourself in. But the reason I post this is to let you know you're not alone. There are people struggling. There are people who are wishing that they had done better, and they know that it's out there, but they just don't know how. And they know they're really, really close, but they just can't figure out that way to help them kind of turn the corner to really do what they want to do with their practice. So I know without a doubt that our livecast webinar is really going to help you with that. So if you're like me, I'll tell you what I thought I was getting when I wanted to be a doctor. You know, I'll say nobody in my family was a doctor. Actually, I'm probably one of the first ones in my family to even graduate from college. So I didn't have that same perspective that maybe somebody whose family has been involved with medicine for a very long time. But I'll tell you what most of us thought we were getting. We thought it was going to be physician and patient-led healthcare decisions, that we were going to go ahead and be the best advocate for our patients, and our patients were going to follow our lead in what we've asked them to do so that we can go ahead and provide them the best outcomes. We thought that quality actually meant quality. You know, that now it seems like those words are used interchangeably with other words like less expensive, cheap, and value purchasing. I mean, what does that even mean? I mean, if you really think about it. We thought we were going to have lifelong patients. We always knew that doctors made a good living, and we were going to have some form of financial stability. We thought we were going to be autonomous. I mean, that's why we went into this, because we knew between our training, our values, and our ability to know what's right for our patients, we knew that we were going to go ahead and be that best patient advocate. And we felt like this was an honorable profession. Now, don't get me wrong. We knew we were going to work long hours. We knew we were going to be taking care of patients, and we knew that there were going to be some things in our lives that were not going to be able to that we were going to have to sacrifice. And we sacrificed for a very long time. Anybody who's been where we are right now knows that we sacrificed through college, we sacrificed through med school and residency, and we had to kind of, so we understand that. But what we didn't know, and what we really got instead, was we got bureaucrat and administrators who lead healthcare decisions. I mean, we have almost been completely taken out of healthcare decisions. We have insurance companies telling us what we need to do. We have people who aren't even involved in healthcare auditing what we've done and saying whether what we've done is appropriate. We've got quality is just really the code word for cheaper. You know, value-based purchasing. What in the world does that even mean? And if you're not familiar with that word, then you need this webinar and you need to listen to our live broadcast even more, because there is a lot of changes going on in medicine. There's competitive threats. other hospitals buying up practices. Now, corporations, we got Walgreens, we got Walmarts that now have actually care providers in their office that are in direct competition with our practices and are threats to our practices. Urgent cares are opening. I mean, just in my small town, we have 3 urgent cares in a population of where we have 14,000 people. We have, instead, what we got was declining income and higher costs. Malpractice threats. I mean, it used to be a long time ago that every doctor you spoke to was talking to you about malpractice and how bad the situation was. And little did we know that's bad, but what we really have changing in medicine and all of those things that are happening are actually 10 times worse than any malpractice threat we've ever gotten. Overburdening government interference. I mean, my goodness, the government's telling us how many bullet points have to be on our physical exams, making sure that there's certain words dictated, certain words not dictated. There are 0 incidence events, meaning if the government will not pay for hospitals for surgery and services where they have what are called 0 events, meaning an event that is never supposed to happen, that you and I know through the course of operating, through the course of taking care of patients, there are some complications. I mean, urinary tract infections obtained in a hospital now are considered something that should never ever happen. Pulmonary embolisms or DVTs. So the government is actually practicing medicine, and it's not coming from doctors who are telling the government what to do. It's coming from bureaucrats. And then if you're somebody who has a lot of student loan debt and a lot more than you bargained for, then that's another thing that you have to really consider that we've gotten that we weren't really planning on. Or we said, well, I knew I had a good amount of student loan debt, but I was expecting to have some of that financial stability to be able to pay it off. And then let's not forget MIPS, PQRS, HIPAA, MACRA, maintenance of certifications, ICD-10. I mean, the list goes on, the letters go on, electronic health records. And now instead of working long hours taking care of patients, we're finding we're working long hours just really staring at a computer screen. And we're spending more time documenting the visit than actually performing the visit. I mean, something is really wrong. And the truth is, as destitute as we feel with all of this that's happening, and as much as we feel that the threats from the outside world, we really have to realize that our patients need us now more than ever, because they're being bamboozled into thinking that somebody else really cares about their health care, and really what it is that what they really care about is saving money. And granted, healthcare costs a lot, and we have to decide as a country whether or not we want to spend what it takes to take care of people, or whether we want to be the Walmart of healthcare. And unfortunately, that's where I think a lot of this is going for those doctors and those providers who aren't really savvy and haven't created a niche for themselves. So let me just give you a little brief interview about my practice. I'm going to go into it a little bit more in the live broadcast, but in less than 5 years, I became completely intentional on changing my practice. And during that time, I doubled my practice revenue. I was a practicing OBGYN. I was able to stop delivering babies at the same time as doubling my revenue. All of this while continuing to work a 4-day work week. And now that I'm not delivering babies, my call responsibility is negligible. It's essentially just being on call for my patients. And the nice thing is now, before I had answering services and I had a beeper service and they had to call me and contact me so many other ways, now I could just give my patients my phone number, because what I'm doing isn't something that requires such intense care that it's around the clock like we have to do with when we're still delivering babies. So this was my dream. So in 1999, I started my practice with my partner out of residency, and we had a 1,900 square foot portable office. 2017, I moved into an 11,800 square foot office that now I own. I used to rent the space before, and now I own. I was able to build this facility that you see here on the slide. And our practice went from 2 doctors to performing who are OBGYNs, to now 2 providers doing cosmetics and GYN, 2 nurse practitioners doing GYN and primary care, 1 full-time and 1 part-time medical esthetician providing services in our building. So this may not be your dream. This was mine, and this is what I chose to do and where I wanted to take my practice. So the important part of this is recognizing that your practice is what you want it to be. I wanted to spend more time with my family, and you can see here I have a son who is in college, who's playing football up in Maine. I have a daughter now who's just about starting college, who's going to be who's playing basketball. I enjoy spending time with my family. My family is tremendously important to me. I love giving back to the community, and I have more time to do that now. This is a picture of my wife and I on Dancing with the Stars, our local Dancing with the Stars event, where we go ahead and dance and get voted on and raise money. You can see we donate to different charities. We have the Special Olympics, our local high school. I was even giving a program for the local Girl Scout organization. And I really have that time to do all of that. So now it's your turn. What is your dream practice? And this is where you're really going to have to start to think, and you may not have considered it before, but really this is why I want you to listen to this webinar right now, is because I want you to have it in mind when we start to go ahead and talk on our live broadcast. And I think that's when, once you are able to start to have some seeds planted on what you really want to do, that's when it'll really start to click and make some sense. But you've got to start thinking about it now. Because life always offers you a second chance, and it's called tomorrow. And that's really the truth. It is not too late to change this, at least not for you and your patients and your immediate circle and your family, and your circle of influence can really be changed. So it's time. So there's a worksheet that's provided in this email as well, where it gives you some fill in the blank ideas for what you want to write to be your dream practice. But you have to decide. I can't tell you what you want your dream practice to be. You want to decide whether you want to stop accepting poor payers. In my community, Medicaid is very, very difficult to work with. We have so many Medicaid managed care groups that don't pay for services, even and when they do pay, it's really difficult to make ends meet and provide good care to those patients. Or do you want to just stop accepting all insurances altogether? Do you want more of a boutique practice? Do you want to do something more along the lines of concierge medicine? Or do you just want to focus on health and wellness and really not chronic illness? So this is really the time to start thinking about what it is that you want to do. In our practice, we decided we were going to add cosmetic procedures. We focus on hormone replacement. We also have an affiliation with a weight loss clinic. So all of these things are, again, what we wanted to do for our practice. But this is something you have to decide. I'm not going to tell anybody you have to do what I have to do, because what you may want and what your dream practice may not be what mine is. So again, you decide. Do you want to focus on weight loss? If you're a gynecologist, do you want to focus on incontinence? Do you want a 4-day work week? Do you want a 3-day work week? Do you want to have more vacation time available to you? Do you want to work on pain management? And again, there is no right answer. This is just about what you want for your practice, for your family, and for your patients. So, think about it. What part of medicine do you love the most? And I can help with this. When you decide what part of medicine, and it may be just simply as, I love what I'm doing, and I want to do more of it, and I want to get busier at it, and I want to get paid better to do that. And that's also, we can help with that. And all of this is really going to, my 4 steps that we're going to talk about, my 4 modules rather, that we're going to talk about in our live webinar, really go over what it is that you can do to find the part of medicine that you love the most, that you maybe have a hard time seeing right now because of all the administrative burdens and financial difficulties that we're facing. So let's set some goals. You have, again, your worksheet. You want to make goals that are measurable. You don't want to say do better. You want to say, I want to go from this number to this number. So you want to also create a timeline to reach those goals. I suggest nothing less than 3 or 5 years of a timeline. I think if you really start to stretch it out further than that, then there's really no drive to start today. So it's really important, again, to get something that's measurable, to come up with a timeline on how long you think it'll take you to reach your goals. I had to do mine on my own, so it took me a little longer than I probably needed, but I learned a lot of lessons along the way, and I can help shorten the learning curve for you. But it's important that when you set these goals and you set your timeline, that you write them down. Put them down on a piece of paper, because that's tremendously important. There's something about writing our goals down that gives us a little bit of that imprints on our brain of really what we need to do. So when you get your goals written and you get your timeline, and you get what you find about medical practice that you love the most, that you want to do more of, then you want to display them, and you can remind yourself about them every day. Whether you want to put them on your office desk, whether you want to put them in front with your office manager, whether you want to share them with your staff and place them in public, in your office and in places that everybody can see. I think that sharing them and displaying them are important for you, and also important to hold us accountable, and to have somebody ask us those questions. Because if we never really we tell everybody what we're trying to do, nobody's going to check on our progress. But just knowing that somebody's going to talk to us about our progress and ask us how we're doing, all of those things kind of hold us accountable and kind of make us kind of act on our goals, rather than kind of just leave them there and maybe reach them when we have time. Because if we wait till we just have time, we're going to find that it's going to be difficult. So another goal that you want to discuss is how much money do you actually need to make for your practice. And what I mean by that is, how much money do you need where all your financial problems will go away? We hear so much about money problems and all the problems that it creates in people's lives. But the truth is, if all you have are money problems, then you're very lucky, because you have been blessed with with training and a license and a heart for doing something that allows us to be reimbursed. And if we structure it properly, and if we do things the way that they need to be done from a smart business perspective, we can go ahead and earn the money that we need to make those problems go away. Because you have to understand that there's no shortage of money in the world. There is an actual abundance of money out there. So more than you and I or anyone listening to this right now can ever obtain. So don't think that there's a finite amount of money. There isn't. And you have to believe that. And I can't stress to you enough the importance of understanding this concept of abundance. So come up with a number, write that number down of how much it is that you think you need to make. So what I mean by that is, to get yourself out of debt, to be able to save enough for retirement so you can retire when you want to have time to spend with your family, to take time off and dream vacations, to help pay your college for your children. Those are the things that I'm speaking about. To give back to your community, and that can't be stated enough. What is it that you need to make to be comfortable and to have the things that you want? And putting that number down again on your goals and having that timeline put together really makes a tremendous difference. So some other things I want you to kind of do and make sure that you put on that form is really, where are you now? Now, don't worry, I'm not asking you to share these numbers with me. You're not going to be posting them. You're not going to share them online. These are really numbers just for you so that you can know and move forward with your training that we're going to go over in our 4 other modules. So where are you now? What is your annual practice revenue? And I would go back at least 1 year. What is the annual number of new patients you've seen? Again, at least a year back. The annual amount you spend on marketing. And for a lot of people, there may not be very much, and that's okay. Whatever the number is, it is, but it's important to have that number. And what we mean by marketing, if you use Yellow Pages, if you use anything on the computer or digital marketing, if you have commercials, if you have put anything in the newspaper, if you put things in yearbooks in your local school's yearbook, all of those things are really what I'm talking about, and to come up with a number for how much you spend a year on that. And then annually, what is your take-home pay? And again, these numbers are for you. I'm not ever going to ask you to share those with me. You're, again, never going to post them. These are numbers for you so that you can be prepared for our webinar, and that you can kind of get a good leg up on what we want, what we're trying to get across, so that you can start implementing all of the things that we talk about in our live broadcast. So remember, on our webinar, I'm going to show you the 4 steps to get from where you are right now to where you want to be. But you have to know where you want to be. You have to know when you want to be there, and you need to know how much you want to make, because those are things that you have to have in your mind ahead of time, and I'm going to show you how to get there. So go ahead and save the date. Put it in your computer right now, or put it in your cell phone, and your smartphone. Make sure your office manager, your wife knows, and dedicate the time during our live webinar to watch what we're going to go over for you, so that you can start taking care of you, your family, and your patients the way you always dreamed you were going to, and not the way somebody else has been telling you how to do it all of these years. It's up to you, and I believe you can do it, and I know for sure I can help you. I look forward to seeing you at our broadcast.